It's a new day, a new year. Hello, welcome. We're coming to you live from our studios here in Kokomlemle on digital address GA0992539. Our lead stories this hour. Schools reopen with a shift from trimester to semester for junior high schools and a significant change to the academic calendar. Several questions on the minds of parents and guardians. It seems if you are one of them, we have some answers for you as we assemble critical players in the education chain. Also, we focus on the safety of our children as they go to the classrooms from coronavirus. Also coming up in this bulletin, 20 minority members of parliament charged with unlawful assembly failed to show up in court today. While they are in parliament, they insist they did not receive the court summons. The Pulse is brought to you by Global Communities Dignilu Affordable Safe Sanitation. Join us on DSTV 421, GoTV 144. We're streaming live on YouTube and on our other social media handles. Do send a WhatsApp message to 0540109009. My name is Gifty Ando Apia. This is The Pulse. Please be my guest. Last night, President Akufo-Addo announced the resumption of academic work at all school levels across the country.
Even when the vaccines arrive in Ghana. By observing these protocols strictly, we're also making sure that the imposition of crippling restrictions and lockdowns do not become options for government. Until then, government, in consultation with the appropriate stakeholders, will continue to pursue a strategic, controlled, progressive, safe easing of restrictions, this time in all public and private basic schools, junior high, senior high, and tertiary institutions across the country, beginning this month of January. The lessons drawn from the reopening of some sections of our educational institutions in the course of last year have put us in a much better position to oversee successfully the full reopening of our schools. Our children must go to school, albeit safely. We are satisfied that in the current circumstances, the reopening of our schools is safe. So from 15th January, our children in kindergarten, primary, and junior high, in both private and public schools, will be back in school. All SHS1 students will start classes from 10th March, with all students embarking on a single-track academic calendar. Their seniors in SHS2 and SHS3 will, however, return to school from 18th January. I must stress that SHS3 students in all schools, like SHS1 students, will no longer run the double-track system. The expansion of infrastructure at the various senior high schools over the last 3 years has brought us to this favorable situation. However, the double-track system will still be applicable to SHS2 students in schools that are employing it. Students in universities and other tertiary institutions are to be in school from Saturday, 9th of January.
That's President Akufo-Addo last night. It brings to an end 10 months of closure forced by the outbreak of COVID-19 in China, which has since spread to the rest of the world. Starting from the 15th, kindergarten, junior and senior high school students will now be able to access education in the classroom. So how safe will that be for the different age groups? That's our top story today. Our panel of experts will help us explore this subject in detail when they join us shortly. But we have public health expert Carlos Tego, who is a deputy education, we also have the Deputy Education Minister Dr. Yao Educhum, Executive Director of Child Rights International Right Appear, as well as the President of NAGRAT, Angel Kabono, joining us. Now, that crack panel will help us deal with this all-important subject of school resumption here in Ghana. First of all, let's take a look at some of the protocols that government has announced it is putting in place.
Prior to their return to school, government through the Ministry of Education and the Ghana Education Service will ensure that all institutions, public and private, are fumigated and disinfected. Schools and institutions with their own hospitals and clinics will be equipped with the necessary personal protective equipment and have isolation centers to deal with any positive cases. All other schools and institutions without their own clinics and hospitals have been mapped to health facilities. There will be, for now, no mass gatherings and no sporting activities. However, religious activities for students at school under the new protocols will be permitted. Social distancing and the wearing of face masks must become the norm in our schools. The requisite provisions have been made to ensure that students at all levels of the education ladder receive the minimum number of contact hours upon their return to school. To facilitate the safety of students, government through the Ministry of Education will provide face masks, Veronica buckets, hand sanitizers, liquid soap, rolls of tissue paper, and thermometer guns for the safe reopening of the schools. The Ministry of Information, the Ministry of Education, the Ghana Health Service, and the Ghana Education Service will, from Monday, 4th January, commence a series of sensitization campaigns to help prepare, inform, and educate guardians, students, and the public on further modalities associated with the reopenings.
At the Education Ministry, some of the officials have been telling us how this will pan out. We'll tell you what my colleague Maxwell Akbaba gathered on the location. But on Zoom with me now is Dr. Benedict Kalis Tego, who is a public health expert. Hi, Doc. Good afternoon.
Hello, good afternoon. Okay. And good afternoon to your chair.
Let me take your preliminary thoughts on our new situation. I mean, right now we're going to school. Whether we like it or not, and whether parents like it or not, they'll have to take their children to school. You've had also the protocols that government says they've put together to ensure that our children are safe. What are your thoughts?
Well, it's a mixed feeling. Personally, I think the decision by government to reopen schools is a very bold one, which needs to be commended. I mean, considering the fact that nobody knows for how long COVID is going to be around, and we cannot put education on hold forever. So I think it's a very bold decision that needs to be taken. The important thing, however, is how this is all implemented. So a lot will depend on how this is rolled out. And I would be looking forward to guidelines and directives from the Ministry of Education and the Ghana Health Service in that regard. But I think it's a very bold decision for the president to ask for reopening of schools. I think the president's call for schools to reopen is a very bold decision which needs to be commended. We do not know how long COVID-19 is going to be around, and we cannot suspend education indefinitely. So I think it's a call in the right direction. It's been done in other jurisdictions. However, what needs to be done now is to monitor the implementation. How exactly is this going to be rolled out? And I said I'll be looking forward to more specific directives and guidelines from the Ministry of Education and the Ghana Health Service in the days ahead. Because as we know, we have public schools, we have private schools. And my concerns would be with effective monitoring of whatever directives are given. considering the fact that ever since COVID started, we have had policy directives, but unfortunately, even though these directives were in the right direction with good intention, the implementation leaves much to be desired.
Talking about implementation, we'll be going through the calendar and then the new calendar that the government has put together, hoping to deal with the problem that this situation has created for us. But if I were to ask you, Doc, in terms of class numbers, what would be your recommendation? Because parents seem to be worried that it's good to go back to school, but with, people don't seem really serious about the COVID protocols. So putting children back in school and looking at the number of people that we have in a traditional Ghanaian classroom, there are concerns that that could even endanger the lives of students and open them up for infection.
Thank you very much. I honestly share those concerns about class sizes. We cannot give definitive numbers for each class because the sizes of the classrooms will vary from one institution to the other. And that is why I made that earlier comment that I would be interested in the fine details that the Ghana Health Service and the Ghana Education Service and the Ministry of Education would communicate to the various schools, especially with the private schools. Because we cannot go back to school and cram 80 students in the usual class sizes. We need to look at all these vis-a-vis the preventive measures. How can we ensure that there will be social distancing in the class? How can we ensure that there will be effective wearing of face masks in the school premises? These are things that we should be looking at. And I think each school would have its unique challenges. So it would be very difficult to give a blanket directive. But we would need to monitor this on a case-by-case basis to determine what needs to be done. Because there are schools that have class sizes in excess of 80 or 100 students per class. And I know of schools that usually have class sizes of 30 and 40 pupils per class. So we cannot give the same directive to these categories of schools who have different sizes. So it would be interesting to know exactly the plans that the Ghana Education Service has in mind. And then we can either make inputs or otherwise to those directives.
Doc, what I'm going to do is that we have the Education Ministry officials have announced the rollout of some wide-ranging measures that is supposed to ensure that they go back to school and do so in a way that will help them catch up as well. I want to take you through that calendar. I will try and explain to you some of the things they're saying. I don't know if you yourself have seen it, but this is it looks like a PowerPoint presentation put together by the Education Ministry, and it talks about how the semester or how the terms are going to look like. Let me start with, I'm going to start with the SHS, the calendar for the SHS. Now, if you're looking at your screen at the moment, we're seeing January to February as the period within which senior high school 3 students will be in school. So SHS 3 students will be in school between January and February. By March, they will be on vacation. And then they come back to school in April to May. In June, they go on vacation. In July 2021 to August, they go back to school. In September, they write the West African Senior West Africa Certification Exam. And then by November, December, they would have ended or finished school. They're supposed to, within this period, finish with contact hours of 1,080. I mean, these are more education, so of course you're more of a public health expert. But I just wanted to take a look at this. We'll be talking to the other panel members who will join us subsequently. But if you look at the first semester, that is for the senior high school, and then the green colors that you see there represent senior high school 2, that is SHS 2, and for the green track, they will be in school between January to March and go on vacation in April and May, come back to school in June and stay till August, go back on vacation in September and October, and go back to school in November and December. And then the same SHS2 students will go back, who are at this point on the go track, will go back to school between March and June. They have vacation between July and August. Then they go back to school in September to December. For the final year, for the first year students who will just be admitted, they will be in school from March. In fact, they will be admitted from March to June, and then from July to August go on vacation, and then from September to December they will also be back in school. From a public health perspective, is there anything you can share based on this particular calendar?
Well, there isn't much to say by just looking at the calendar. The calendar just tells us the contact hours that these students will be in school. I think the most important thing is the modalities that are implemented whilst they are in school. I can say for people who would be in the boarding house, it wouldn't be too much of a difficulty because they are in a closed environment, and therefore the issues to look out would be the teachers who would be moving in and out, and if there are day students, the day students who will be commuting between the home and school. And then what measures would be in place when these people arrive in school to ensure that they disinfect before joining their colleagues. Then the other thing to look at would be the actual contact hours in the classroom. It would be advisable to have a lot more frequent breaks so that people are not kept in the classroom for prolonged hours. And we should also look at, for people who would be in the boarding house, now that we are going to have a full house, what arrangements are going to be put in place? For instance, if they have to go to the dining hall, what sort of arrangements are going to be put in place to ensure that there is adequate social distancing? If they are going to have church services, now that the president says religious activities can't be allowed, what modalities are being put in place? So it's the fine details that would actually help us to understand exactly where the dangers will come from. But I think that just looking at the contact time, adequate, and I wouldn't have anything to say unless I know the fine details of how these things are going to be implemented.
Okay. Dr. Hang for me, let me bring in Angel Carbonu, who heads NAGRAT, who is joining us also via Zoom. Sir, thank you very much for your time. Good afternoon.
Hello, good afternoon.
Mr. Carbonu, right, good afternoon. So I was just going through the sort of the changes that we're seeing in the calendar at this point with Dr. Calistego, who is a public health expert. And I'm sure that as teachers, you have your own concerns about the safety.
Yeah, well, let me start by saying that the semester program for the junior high school, per my understanding, is for the solution of this emergency. It is not a permanent feature. That is my understanding.
Okay.
The meeting I held with the Director General.
Okay, Mr. Carbonu, so you're jumping a bit further into our discussion, but that's okay. We can focus a bit on that. Now, you're talking about the change from the trimester to the semester for the junior high school.
Okay, let me get your specific question so that I answer it.
So because I was talking to the public health official, I wanted us to focus a bit more on the concerns that you have and whether or not those have been addressed in terms of the protocols to make sure that students return to school, but it's done safely.
Okay. Well, we are yet to go back to the school, and per the promise of management, those materials to ensure the adherence of the protocols will all be provided, and they'll be provided adequately. So we don't have any worry. The only issue is that when the schools reopen and we realize that the materials are not there, we will raise concern and raise the red flag, because we are talking about lives of both teachers and students in this case.
Okay.
That is why we are saying that management should ensure that the various materials to ensure that adherence to the protocols are there in the schools.
Okay. On the back of that, as a public health person, he has also raised concerns about class numbers. Are there any guidelines as far as class numbers and how many people are supposed to be in a class at a given time, and how long teachers are supposed to be, the students are supposed to be in a classroom at a given time?
Yes, the class sizes is a concern. And what happened the last time before December was that whenever you have a class size that goes beyond 30, you will have to form another class. This time, looking at the numbers, it will create a challenge because that also talks about space, whether the space is available for a new class to be created. Again, like the public health personnel said, I don't believe that in this time we have to keep students in the classroom for a very long time. And this is where I think that of the CAF decisions, taking decisions on your feet as manager of education or in educational unit is very, very necessary. If I'm a teacher, for example, I will want to have more outdoor classes than indoor classes. I'll bring the children under the trees in the schools if there are, or the shed in the school if there is, so that we can have classes there and minimize the possibility of confinement within the classroom. Again, when you talk about dining halls, all students converge in one dining hall to take breakfast, lunch, and supper. Can we begin to think of the CAF and change modalities quickly and not wait for somebody to come and issue directives? What can we do so that we don't congregate students in the dining hall in such a manner that there could be possibility of infection? When it comes to religious worship, can we ask the children to move into their various classrooms and have some short prayers within 30 minutes than the congregational type of worship that goes on in the school? You don't expect the Director General of the Ghana Education Service or the Minister of Education or the President of the country to come to your school to give you this specific directive. I think that unit school management themselves will have to sit down, looking at the nature of this disease, to take decisions so as to ensure that there will be no spread of this disease.
Okay. Perhaps sometimes it's an issue about standardization and making the guidelines available for. You have said that they have to be able to think on their feet. But what if someone can't think on their feet? What happens to the children? So perhaps.
If you can't think on your feet, then you are not free to be a manager of a school.
No, that's just a hypothesis that I'm creating there. What if? It's a what if question. Okay. So would NAGRAT and the other associations, for example, think of some sort of standardized guidelines that can support in the implementation of these?
Well, standardization is good, but you realize that infrastructural availability, nature of the school compound and environment is very school specific. Which secondary school did you go?
I attended Ashaiman Secondary School, by the way.
Okay. Now, when you look at Ashaiman Secondary School and where it is located, and I know that school very well, you realize that the geography of Ashaiman Secondary School is totally different from that of Tema Secondary School.
It is.
The facilities of Ashaiman is totally different from that of Tema Secondary School. Mm-hmm. So when the headmaster of Ashaiman Secondary School is going to take certain decisions, he is going to take the decisions specific to Ashaiman Secondary School, different from Tema Secondary School. You see, we are not in normal times. We are in times that we try as much as we can to provide education to the extent to which we can provide it. Okay. So that we don't have a vacuum and also a suspended development and growth of our students. That is what I'm talking about, looking at your situation, taking decisions to ensure that you protect your situation. Life, teachers, and students.
Very well understood. So now let's come to the semester and the academic calendar and the changes that we're seeing. perhaps we can start with the senior high school. Do you have any concerns about the changes there as well? Because apparently there are a number of contact hours that have been lost. And to be able to meet that number, there has to be some adjustments which have been made.
Yeah. Yes. Look, the issue is that if we were in normal times, you know very well that the unions were going to kick against this type of timetable. I mean, or this type of calendar, you know very well. But this is also not the time to be going to kick against models and all that, because this model is a short-term intervention to solve a problem so that we can all get back to a state of normalcy. For someone to go to school 2 months, come back home, go to school 2 months, it's not the best. But again, we are saying that it is because of the times. In one way or the other, you will have to manage the situation.
Okay.
I am a teacher and at the same time a parent. And I will advise that if you think that this calendar as it is going to be the ultimate solution to the knowledge acquisition of your child, to prepare the child to write an examination, I will say hello. I will advise parents so that when the children are at home, they get the children some instructors for them to help those children. Again, one thing in this country, and that is creating the problem. If we had had a strong ICT base where we are in full throttle with our ICT, while some students are at home and others are in school, especially those who are doing double track, there could still be instructional communication between teachers and the students. My union have taken it upon themselves that going forward, we are going to encourage all our members to become ICT compliant within the shortest possible time. We have even asked our members that even your lesson note preparation and all that should be ICT based. If we were having that, this problem wouldn't have been a problem. Unfortunately, we don't. So again, I don't know how far government have gone with the provision of the Wi-Fi in the various senior high schools. I want Joy FM to check on that on behalf of all Ghanaians to see whether, as promised by the Vice President, whether the Wi-Fi's have been fixed in all senior high schools. This is also going to help ensuring that we can communicate with our students. So the timetable is not the best. The timetable is not a solution, but in the current circumstances, we are prepared to work with it.
Let me bring you were talking about the JHS bit, where there is a shift from the trimester system to a semester system. So schools are supposed to be, junior high schools are supposed to be in school from January all the way till May. And then in June, they go on vacation. They come back to school in July and all the way to November. They write the BECE in November. For JHS 2 is the same thing, it looks like. JHS 1, the same thing as well. It's for the JHS 3 students who will be writing the BECE in November. Yeah, you had a point on that one earlier. Mr. Kabonu? Okay, so Angel Kabonu there, he's representing NAGRAT for us in this discussion. But let's hear from parents on this reopening.
As a parent, I personally am prepared and I'm ready to give anything that my children may need to go back to school. But my main concern is how prepared is the president too? Because we are not seeing any expansion of old schools. We are seeing only the old buildings, and the students that are they going to separate them to various schools? And how is that going to be, since we are not seeing new developments? Because the school that my children are going like this, I'm not seeing any new developments. I'm not seeing any progress. So when they happen to resume today, my children going to be in class like 34, 32 as they used to be, because there is no expansion going on in the school. I pass there every blessed day, no expansion. So actually, we the parents, we will be ready to do everything to support our children.
Okay, as a parent, I'm not ready for my child to go to school because I feel my child is too young. looking at how kids are, and then in their class, I think they have 2 teachers. But with their number, I don't think they can be able to observe the protocols as the president wants everybody to do. Even in town, you can see some are wearing the face masks, others are not wearing. You see kids running here and there, and to me, I feel it's not safe.
Since the COVID took place, there are so many measures that you're supposed to put in place. Maybe there should be a provision of nose masks for the kids, and then every class, depending on the school that the kids find themselves, they should be able to minimize or reduce the number of students in the class. And the president should also ensure that in every school, he will send people around to supervise whether all these things are being put in place to ensure the safety of our kids.
I think the school need to be open at that boy. I'm young, so I'm school. And since COVID nearby, and I'm like financial difficulties and stuff. Aside and also no, in Kuala 80 no, me who say emboa. Because if you have time to go school regularly, at the end of the day, no result never by 90%. Now you have online news. Now you be a bit because me say me will fear salary issue number form. Intimate the bundle. The ama akwala with me access online education. And I think so mu be a beboa.
Aka president take back belegbe ni beke bia school. Kwe won suma ke egbele ni beke bia school aka anu kwale ni beke bia ba hyen ya hunto. Ye fo ye wo be de kan ta flache wo kan yin fo. Shi ye ameju on wo joje na me kwe. Shi anwa bomontu ni ekwaka nyongbe boe apekole. Shi wo mele ke fe to wo fe traders. Ni watch one, because be on what you are machine. And one was you are machine. Come here, but me, social money. She school like a car, bele, na mete, just me baba Jemmy. Teacher say, well, I come and know me wow, no call will be. Calico and Abba fade for money. I can be a buyer, skitty ben, no coca, ya. A one who call a sham, one can be a bar, and call it one buffy. Kone beke bi abon school ya ka mete school ba wa ye for year wa
ye nta be to obi school ni se ye mane tifia e wo me se ye sua o mu sua de de nanso o mbe bon and school no so de eboa aduane ne de ene wo wi gale kura banku ni mako batimi awe awe ne saa ke ka wi ada na ehia sa akora ne be ko sua de ye nam yanti me anko school ni bi ene ti na ye force say ya ale ne wo ho mom de nanso ye ma ne betia ba school ama teacher for na mo wo ho no o betima protect ye ma ne ye e wo school mu ho sa akwa ne fa ne sanko to fam ne ma me de sanitizer ba sha ne bag mi na wonya ne basa basa.
Some parents there, I'm having this conversation with Angel Kabonu, who froze on us a short while ago. But Mr. Kabonu, I do have you back. I was waiting to hear your thoughts on the JHS calendar, which is now more a semester than a trimester.
Now, can you hear me now?
I do. It's a bit unclear, but let's try and see.
Okay. Am I okay?
Yes, please go ahead.
Right. I'm saying that if it were not times, will be the reason JHS should run a semester program. Because what it means is that the semester program keeps students in one particular time in a school for a longer number of days. Looking at that age bracket, whether the semester system was going to be okay. But that is why I said that we are not in normal times. So, and then we've lost a lot of time, especially for those who are going to HS3. Therefore, these are interventions to be able to solve the problem as best as we can, and we are ready to go with it. The only issue here is that let us ensure that all that is promised to be provided are provided so that the teachers can also be versatile and do that they can do.
But what problem could there be? I mean, assuming we're not in the difficult times you describe, if students have to, I mean, JHS has to be more of a semester rather than a trimester, apart from the number of days you mentioned that they'll be in school.
Well, you see, with the semester program, you pick a course and a program and you exhaust it within one semester module. But when you look at education down there, you don't exhaust courses within program.
I'm losing you again, Mr. Kabunu.
That's accumulated.
Let's try this again. So you were saying, my question was whether or not, apart from the number of days that students are expected to be in school, there's a problem again.
Okay, I'm saying that in a semester program, you exhaust one course within a module, and sometimes don't even go back to that course again. But in the type of system we run at the business schools, you accumulate information and knowledge so that they all go and write that in final exam. That is one problem or challenge that I see with the semester program at the basic school level.
Okay. I'm sure that there's a possibility of tweaking it to make it better and to deal with the problem that you're raising. But Mr. Kabunu, just hang on for me. Let me bring in Brighter Pierre. He's a child rights advocate. Mr. Pierre, thank you for your time and good afternoon. Now, if you look at the semester, the calendar that we have here for kindergarten and primary school, for example, they're sticking to the first, the trimester. So we have the first term, the second term, third term, etc. You've done some work about the impact of staying at home on the lives of the children. So certainly this comes as good news, doesn't it?
Yes, of course. Opening schools is a good news based on the work that we've done so far and some of the issues that children are confronted with. So on the basis of that, I think that it is a good news. But though it's a good news, there are other things that must also be put in place to make it a better news for all of us. So we are anticipating that those things will be put in place. And then also you will see clearly that based on the announcement and then the press conference that the Director General held, you clearly see that there are some changes that are going to happen, and we want to see how those things are going to unfold.
Okay, Mr. Pierre, let me just jump in. Sorry, let me just jump in there. I want to bring in the Director General and what he said, since you've mentioned him, so that the other members on the panel can also, listen and be on the same page. So let's take you to the Independence Square earlier today, where they held a press conference. The Director General of the Education Service has been speaking.
This time round, JHS will be running semester program. JHS will be running semester program. As we have always done, we make sure that the basic protocols are observed. So there will be disinfection of all schools. There will be provision of Veronica buckets, soaps, hand sanitizers, and tissue papers to the schools. We will also provide the washable and reusable face masks, and then schools will not be available for outside activities. We will also continue with our online TV and radio programs to support teaching and learning. Way back in 2017, we worked with Ghana Health Service to map out health facilities in the districts, in the regions, in the towns, in the cities for our SHS schools. Again, we also ensure that all our schools have some sick bay facility. And this arrangement is the one that the President talked about. We are still going to ensure that the mapped schools and then the primary and the JHS schools are also mapped to health centers. Now we have health centers up to what we call chip compounds and all that. So that is an arrangement that we're working with health to make sure that we improve on it. On the issue of flouting of restrictions, we've had 2 phases of school reopening, and we are glad to say that during those 2 phases of school reopening, there were no major issues of flouting of restrictions. But if for any reason a school flouts the restrictions, there are ways of dealing with that. Not only these restrictions, but all school regulations and things like that. When schools flout them, there are regulations that cater for that.
So that's Professor Kwesi Opoku Amankwa, the Director General of the Ghana Education Service. Was actually speaking at a separate press conference. We'll take you to the Independence Square shortly. So, right, back to you. He talks about all the things that have been done to make sure that the schools become safe. He talks about disinfection, provision of Veronica buckets, reusable face masks that will be provided for the children, not allowing people, into the schools for any activities, online and TV radio programs, which will continue. And then they have mapped the schools up with health centers. Good, isn't it?
Well, it is, but if you look at the whole arrangement, adjusting the calendar to run it at the semester, even at the GHS level, I personally feel that there's a lot of work that must go into it because of the way we have restructured our examination system. From the policy point of view, it makes sense to them because, one, the opening in January will let them run the whole year, which would also correspond with the budget allocations of government to the ministry, so that when there are any other issue, they can make provision for it, so that they can run it within the in line with our budget allocations and all that. So they have achieved the purpose with that. But you should also look at the end of that design, that the way we have structured our examination in this country, you'd have to run the system for a while, till the end of it in order to run your exams. So it means that children are going to spend more than 5 months in the classroom before they go and write the examination. But we've not also done any assessment to find out whether or not that would be applicable in the minds or with the children, and how, so that we can run it properly. So that assessment was also missing. Again, the one thing that is also missing has to do with the fact that during the school closure, Ghana Education Service and its Ghana Health Service did not take any steps to sensitize the children who are at home on observing protocols, knowing that schools will open in January. So we have not prepared the minds of children to get back to the classroom. And this is one aspect is psychological, and that also the other aspect has to do with how they are going to comply with the protocol measures that are going to be put in place and all that. So there's no preparation whatsoever for the nursery schools, the primary, and then the GHS. So these are issues that, for me, that must come to the table. So we should not always only look at the physical provisions that they are going to give as a response to the protocols, but how the behavior of students are also going to have a bearing on the usage of the material that is going to be given to them, so that we don't have a situation where children would go to school, forget about themselves, and then use all manner of means to engage. Because once they are going back to school, we should know that this is the first time some of them are going to meet their friends, are going to meet their colleagues. So the entry point, the socialization aspect would also kick in. But if you don't sensitize them very well for them to be aware of the situation that they find themselves in, some may forget themselves and then embrace each other, have interactions that will promote some kind of socialization, which, because we have not prepared their minds, these are the things that are going to happen. So I don't want us to solely base our minds on the fact that because Ghana Education Service have provided the logistics for the reopening of the schools is enough. I think the question that we need to ask them is that how have they prepared the minds of these students to be able to even use the facilities to adjust to the new system that they have taken advantage of, to adjust the calendars that they are going to run for the year. So these are things
let me just jump in there.
Okay,
let me just jump in there. I want to bring in the public health expert for his perspective on what you have just said. So, Dr. Carlos Tego, you've heard all that he said. I would have said that the students seem, if you talk to most of them, they seem to be eager to go to school. So in terms of their psychological readiness to get to school, it's as if they've always been in anticipation. But the point Bright is making is that they absence, from, the not seeing each other for a long time will make it will make them more amenable to now wanting to socialize in ways that could spread the virus, should any of them have it. From a public health perspective, what are your thoughts as I conclude with you on that?
Well, I think Bright makes very useful remarks in that regard. And let me share some personal experience with you. I am a lecturer in the medical school. Now, when the universities were asked to return to complete their academic year, what we did was to organize an orientation for each class as they came in. Okay. Now, even before the orientation, whilst they were being asked to wash their hands and get their temperature checked, you just look around and the excitement, people were hugging each other, people were jumping in groups. So it's a natural thing. And that's where the psyching up, that's where the education comes in handy. If people have been prepped up to know that, one of the reasons why we've had COVID spreading, and if you look at the current trend, it's spreading in close societies. So you have families. You have a family, maybe 6, 7 people in one family. And that is because of what we'll call familiarity. Oh, I know this person. He's my friend. He can't have COVID.
Yeah.
Oh, that is my best friend. He doesn't look like somebody who has COVID.
It happens to all of us, doesn't it?
The issue of familiarity has been one of the biggest bane we are dealing with. So if people are not properly psyched up and they get into the school environment, what would be your natural reaction if you meet a friend you haven't met in a year? The natural thing would be you want to hug, you want to hang out, you want to. But
so at your level where you're dealing with medical students, you had to do orientation. But for kindergarten, children in kindergarten and those in primary school and junior high school, what recommendations are there from a public health perspective?
Being in kindergarten doesn't mean you can't give an orientation. It is the contents and the modalities that you adopt. There is the same way you can convey this message to a kindergarten 1 or 2 people for them to appreciate it. They may not really comply as the adults will, but at least some of them would have an understanding of what it means to stay away from people.
Okay.
I have children in both primary and JHS, and ever since COVID started, people have been accusing me, what have you been telling your children? Because even when I take them out, they are more concerned about safety than sometimes I am myself. I do something and they would have to prompt me, but why are you doing this?
Okay.
Okay. And it's because of the education and sort of conversations we have back at home. So it has become like second nature. So I believe that parents have a role to play. We can't leave everything to teachers in this regard. We can't expect Ghana Health Service or Ghana Education Service, or for that matter, government to do everything for us.
Give me your concluding thoughts. Your concluding thoughts on all the conversations that we've had and the bits and pieces, and your advice as you were just putting it to parents, especially.
Well, so I think going back to school is a good idea and it's necessary, but then everybody has a role to play, from parents to teachers to managers of schools. And I would be looking forward to a situation where schools will be tasked to come up with the modalities they are putting in place for these to be inspected before they are allowed to reopen. And following reopening, I would expect that there would be a task force that would go around to check whether schools are really complying with these modalities. Because if we look at past directives that have been given, a lot of them have been flouted with impunity, and no measures have been taken to, punish or bring these people to book. So people flout it, people go about without wearing masks. Beaches are supposed to be closed, but we are having beach parties. Pubs are supposed to be closed, we are seeing them opened. In the full glare of the public, nothing is being done. So my only hope and prayer is that as we open up schools, we would put in measures to effectively monitor so that these regulations or preventive measures will be strictly adhered to.
All right. Doc, thank you very much for your time this afternoon. Dr. Khalis Tego there, he is a public health expert who joined us, for this discussion. You've heard what he has to say. Parents have a role. All of us have a role in keeping our children safe. Bright Apia is still on the line with me. It looks like we've lost Angel Carbon, who would have taken his concluding thoughts as well. But Bright, now we're looking at, latest January 15, we're going to, a section of the students are going back to school. From your office, you have talked about the fact that we haven't really done a lot of work about the psychological preparedness of our children there. Is there some work ongoing, or is this something that an idea you sell to the Ghana Education Service to pursue?
Oh, yes. We've been having a backdoor discussions on how to move this process forward. And I know Ghana Health Service is also helping the schools to have some kind of information available. But I'm just looking at the time, whether they will be able to do it. Because as we speak, once we open school, from now till March, we're going to have about over 9 million children who are going to be in school. So it means that our programs and activities must also be at a certain level where it can meet the needs of over 9 million children who will be in school and all that. So we are hoping as organization, we will still continue to do what we have to do. But we think that the system must also be very responsive, so that the teachers would also be there in the school to provide the kind of knowledge that they need. Parents must also assist their children at home to be able to obey the protocols. Because the point is that based on the research that we have done, the effect of COVID amongst children is not as dangerous as compared to the vulnerable groups or the adult population. So that is the good news out there. But what we've not been able to determine is whether or not when children get COVID, they can easily transmit it to the adult population. And that's where the danger is. So it will be in the interest of the adult population, in this case, the parents and teachers, to also ensure that children follow the protocols so that they don't become vulnerable to children when when children get the virus and all that. So whatever we have to do as parents and as the adult population, it is to our advantage to ensure that children follow the needed protocols, so that we the adult population do not become vulnerable to children. So let's all of us play our role. And moving forward from next week, Monday, we will roll out some activity to also provide some education to our children as well as parents on the school reopening and how they have to obey the protocols.
Bright, thank you very much for your time this afternoon. Bright up here there, he's Executive Director of Child Rights International, and they are into children rights advocacy. Let me take you now to the Independence Square, where government said has been briefing the media on preparations for the reopening of schools. Maxwell Agbagba was there for us as the equipment for disinfection programs was displayed.
We also have drones, and these drones are also used in sophisticated areas, in an area spraying where we cannot use this electrostatic machine. So we have these drones, yes.
An official of Zoom Lion showing dignitaries some of the state-of-the-art equipment they use in the disinfection of schools, markets, and other public places. The event was also to demonstrate the company's readiness to disinfect educational institutions ahead of reopening.
Human beings from far distance. So these are the drones that we use in assisting us to reach all the areas that human beings cannot walk in there. Besides this, these are also electrostatic machines. Yes, we have some over there. These machines, as soon as you start them, they are automatic. They do the work on their own. You don't need to be there, and it will work for you.
Director General of the Ghana Health Service, Dr. Patrick Abuaje, says Ghana did not record any case of cholera last year, and there was also a significant reduction in all diarrhea cases as a result of the high COVID-19 hygiene practices.
Because of the increased hygiene, because of the COVID last year, as has been mentioned, last year Ghana did not record any case of cholera. We also had a significant reduction in all diarrhea diseases, and about under 5 children who have diarrhea reduced by almost a third. and that is something we need to look at. We will continue disinfection of all schools to make the place safer as the school reopens. You can see that the kindergarten kid may want to have a red or exchange a mask with a friend, etc. These are all things we are working on. We have to make them take responsibility for their own safety and that of their family and friends in an enjoyable and fun way. So we are going to do an entertainment education program that will be coming up to ensure that we continue educating, especially the KG and lower primary.
He says medical screening of all SHS students will be institutionalized. He has also been talking about collaborations with the Ghana Education Service ahead of the reopening of schools.
Importantly, the reopening of schools. We've been out of school for nearly a year. As part of that, we have enhanced our collaboration with the Ghana Education Service and the Ministry of Education. All senior high schools have been mapped to health facilities across the country. A few months ago, we conducted a nationwide assessment to see the condition of infirmaries and clinics and made some national guidelines out of that. And those who do not have are clearly mapped up. And we are also working on upgrading infirmaries to ensure that those who are in school are safe and are able to respond appropriately. The medical screening for all people, all SHS people, will be institutionalized and be done annually. And that will also be including my first day in school for the newly kids who are coming to school, something we need to look at. So the preschool and lower primary will be monitored as well and supported with the using currently existing school health platforms where health workers go to the school, visit, and of course we have them map up to health centers and hospitals where rapid response can take place.
The Director General of the Ghana Health Service also stated some persons who tested positive at the airport and were supposed to self-isolate did not, quote, manage it properly.
Interesting is the fact that in the last December, the numbers have been going up over the month. We started seeing an increase in October, November, and December was a major peak. We recorded 46 cases in September, 98 in October, 169 in November, and as at the end of December, we have recorded 393 cases. We are in January, in the very first few days of January, we have recorded 36, which shows that the number of cases that are coming, that would have been imported in the country, is high and would have been cumulatively gone up.
Managing Director of Zoom Lion, Gloria Anti, has been speaking about the company's commitment to disinfect schools ahead of the scheduled reopening.
The occasion is also to indicate our readiness and the partners in the pest and vector industry to undertake the nationwide disinfection of all our educational institutions and schools as they prepare to reopen on January 15, 2021. In this regard, we have procured a wide range of state-of-the-art disinfection vehicles and equipment, including 50 atomizing vehicles, 10 street disinfection trucks, 5,000 motorized spraying machines, 5,000 knapsack spraying machines, 100 disinfection drones, and 5,000 handheld spraying machines. In terms of workforce, Zoom Lion alone can boast of over 7,000 spraying gangs across the country who have been well trained with skills and the art of disinfection by the internationally recognized Noguchi Memorial Institute for Medical Research. In order to share our professional experiences, we have also established an association with a primary objective to control pests and vector and diseases through fumigation and disinfection. The association is referred to as the Pest and Vector Control Association of Ghana, which is also known as PVAG for short. This association has over 10,000 spraying men ready to serve Mother Ghana when called upon.
Maxwell Agbagba put that report together for us. You're still watching The Pulse here on the JoyNews channel. We're looking at going back to school, how safe it is, the calendar, the effects of the changes, the significant changes that have been made on the calendar. We've spoken to NAGRAT, we've spoken to a public health expert, and we've spoken to a child rights advocate. We'll take a very quick break here. When we return, we get the perspective of private schools, for example. What do they want in all of this process? We'll also tell you about the other running stories for the day. Just stay with us. Welcome back. Many thanks for staying with us. President of the Ghana National Association of Private Schools, Dr. Damasus Torosong, has called on the government not to discriminate against private schools in the country, but to treat them equally. He said for them to function effectively, they should be given the same opportunities like their counterparts in the public sector. JoyNews' Upper West Region's correspondent Rafiq Salam has been looking at the reopening of schools in the country.
According to the president of the Ghana National Association of Private Schools, Dr. Damasus Torosong, it has been their considered view that schools in the country could have been reopened as far back as last September without causing much risks to the health of students based on assessment they have done, but government thought differently.
We are aware of many cases where students either have lost the appetite for any academic work and may not be coming back to school, or have strayed into some other social activities which will prevent their return to school. Some have gone into illegal mining, particularly those at the GHS and SHS level, and may not come back to school. Others are there who either have become pregnant and will feel shy to return, or have simply lost the learning culture and may not be able to return. Obviously, because of such people and because of the amount of damage that is being done to our educational system, which has been down for 10 solid months, we think that the news of resumption is welcome news indeed for us.
He said school authorities in the country have been eager to get the schools reopened due to the damage that a long closure has done to the educational system in the country.
We would have wished government had announced the resumption way back in December 2020 to have given us sufficient time to get our houses in order before we resume. But to give us a little over 1 week to prepare and receive students is pushing us a little too hard.
After closing down for close to 10 months, the result is what is behind me. You can see the vehicles have not moved for close to 10 months, and some of them even have problems, and they need to be worked on by mechanics.
As you can see within our environment, you can see discarded furniture lying about, you can see buses that are grounded, you can see classrooms that are taken over by termites and cobwebs. We now have to do a lot of renovation, quite a bit of repainting of our structures. Besides that, you see, I'm sure many people are aware of the fact that owing to the long closure, many of our staff have found other means of subsistence. You have teachers who will no longer be available when schools reopen. You have administrators who have found other work doing and may not come back to your institutions. So we have to go through even recruitment, get staff on board before we can resume.
At this material moment, what the private schools are looking up to government to do is not to discriminate against them.
Government has to treat all private schools as if they were public. What that entails is this. It means that whatever educational materials that are required, whatever infrastructure, whatever PPEs are required in public schools and which are supplied to public schools must be given to the private schools as well. We need a 1-year moratorium to get our act in place and to become, strictly speaking, private once again. But for now, we ought to be treated like the public schools are treated. There are some areas of cost that we think government can waiver for us in the time being. For instance, we should go on some tax holiday for at least 1 year. The district assembly levies and the operating permits and all those will have to be waived for us to get our act in place before we can pay those ones.
Over 1,000 students are expected to go into our senior school through this gate. According to the headmaster of the school, Mr. Adam Risu Tedman, the teachers are really excited. They will again have their students back to their fold.
My teachers are prepared. We have sat for so long, and everybody is now eager to be in the classroom. Students are eager, I believe, because I also have kids. If we are to rate in terms of percentages, I can peg it between 45 to 50%. This is because, as I indicated earlier, we are not in normal times. We need to have PPEs, talk of the Veronica buckets, talk of the hand sanitizers and what have you. Then also, the finances are earlier indicated. I think that is the engine for us to propel into the new academic year. So we are just waiting. As and when our accounts are hit, as and when the PPEs arrive, I think we will not have problem when it comes to reopening on the 18th.
Reporting for JoyNews, Rafik Salam. Wow.
Now, students in the Setri East district of the Ashanti region used the long COVID-19 break to take up commercial tricycle riding, which they find very lucrative. The district education directorate, however, fears the students might be reluctant to return to school as they make fortunes from their ventures now. As reopening beckons, the directorate has commenced a campaign to compel students to return to school. Nanaya Ojema visited some transport terminals in the district capital, Efijasi, and has filed this report.
Tricycles, popularly known as pragia, have become a major means of transportation in cities and towns, though illegal. At Efijasi, they are mostly driven by teenagers who are students. 16-year-old Alidu Yakubu is engaged in this commercial activity within Efijasi and environs.
Local school, Islamic, Efijasi Islamic.
I was at Efijasi Islamic JHS when I started the business. During the COVID-19 period, I requested my father gives me his tricycle for business. I make between 150 and 170 cedis daily. The owner takes 50 cedis, and I buy 30 cedis worth of fuel. The rest of the money is mine.
My owner no 50 cedis, and my father can.
What do you have to fuel?
30 cedis.
Yakubu, who recently graduated from junior high school, is hoping to be posted to a nearby senior high school to enable him continue his transport business. I cannot make money in school, so I chose a school closer to me. I want to combine this business and schooling. Bright Ejay, 17, has similar plans. He wants his education to run concurrently with his transport business. I am a day student, so I plan to work on weekends. This is a very lucrative business. An annual income of at least 13,000 cedis from his 50 cedis daily savings is the opportunity cost for Musa Yusuf if he decides to go back to Efijasi SHS when school reopens. I have to go back to school because my parents are against this business. They do not want to see me ride the tricycle. But I do it on their blind side. The emerging trend is a worry to the Efijasi Education Directorate.
The Setri East District Education Office believe
it is very necessary to commence a campaign to bring back these young ones into the classrooms, especially those who are gainfully employed. Frank Opoku is in charge of monitoring and supervision at the Directorate.
We have started what we call back to school campaign, that is sensitizing the parents and the children on the need for them to wake up when school resumes, on the need for them to go to school. We know some of them might become pregnant, especially the female ones, and might even be giving birth to children. But we are saying that should not put them off. There's still the need for them to come. We have guidance and counseling coordinators who are there to counsel them, for them to take their studies very, very, very serious. So that education has started. We are educating the public on the local FM stations, and then churches, marketplaces, and other gathering mosques, for the parents to reawake, so that as soon as school resumes, they will all see the need of coming back.
For about 9 months, schools in Ghana were closed, though final year students had an opportunity to sit for the final examination. Many students were compelled to find means of survival, as most of them were not interested in the virtual learning platform introduced by the government. From Efijase in the Seche East District of the Ashanti region for Joy News, Nana Ojima reporting.
Now, out of 27,455 candidates who sat for the 2020 teacher licensure examination, 8,442 failed to meet the pass mark. The number represents 30.7% of the total candidates who sat for the exams in October 2020. Now, these details were contained in a statement released by the National Teaching Council. Let me take you through that particular statement. There it is, the National Teaching Council, and the story is that the National Teaching Council is set to release the result of October 2020 Ghana teacher licensure exams on Tuesday, 5th of January 2021. That is tomorrow. But before that, they give us a summary. A total number of candidates that wrote, as I told you, 27,455, but 19,013 of them, representing 69.3% of the teachers passed. 8,442 of them nationwide, representing 30% failed. The result, according to some of the results, according to the council, will be being withheld because they're being investigated. But yeah, if you need to check your results, that's the information there. All candidates are supposed to check the result from the NTC online portal at exam.ntc.gov.gh. That's exam.ntc.gov.gh. And you use either your pins given during registration or your exam index number on your phone to get through to your result. And candidates are advised to print your provisional certificate after checking the result. Dennis Osewusu is a public relations officer of the NTC. He signed that. He's joined me on Zoom. Mr. Osewusu, thank you for your time. Good afternoon. So 8,000 plus of the teachers who, according to your release, have failed the exam. Is that worrying, or looking at the number of people involved, it's pretty understandable?
All right. Sorry, I'm a bit under the weather, so my voice wouldn't be that clear, and I apologize for that. Good evening to your viewers. Just like you said, we have a very good number to that passed, almost 30,000 of them. And then we are looking at 8,000 also failing. But then it's either they failed in a subject, 2 or 3. It's not like they failed everything, as maybe it might be stated out there. But
that wasn't clarified in the statement, I must say. It wasn't clarified in the statement that they failed in some. The statement said that they failed.
Normally when you are bringing out the statistics, we don't, because even if you fail a subject, you don't still pass the whole thing. But you have a chance to write again. Okay. And you're not going to write all the 3, but then the one that you trailed, that is what is normally done. That is why when we are reporting, we do it general. We don't restrict it to the number of subjects or courses you failed.
Okay.
But then back to your question, we, National Teaching Council, our aim is to bring sanity into the teaching profession, and the main focus is to professionalize teaching in Ghana. And so, as part of our mandate, we are to license teachers, and through that, we introduce examination for in-service teachers, for pre-service teachers who are yet to join the service. After you've had your training in all the various teacher training institutions, whether being a college of education or university of education, when you come out, we have a common call exam where we put all of you on one scale so that
Dennis Osewusu, there looks like I.
with what we actually.
Okay, Dennis, I'm losing you intermittently. But you're making the point about giving the teachers another chance. What happens to those 8,442? When next are they going to get the opportunity to write?
Twice in a year.
Okay.
And so we write the September one, where because of COVID, we couldn't write in September, but we wrote it in October. That is where we have the results now. And so our next exam is going to be in March. So those who were not able to make it, you still have the chance to register in March and then write per the subjects you trailed, not necessarily all what you wrote initially. So if you trailed in one, that is exactly what you are going to register and then write.
So if you're part of the 8,442 who have apparently failed in a particular subject or so, you still have an opportunity to rewrite and get your license. Now to our other top story. Minority Leader Haruna Idrisu has justified the NDC MP's decision not to honor a police summons before the Accra Magistrates Court this morning, accusing the police of targeting them for humiliation. He's been addressing a press briefing in Parliament House.
I woke up this morning to some blaze of news in the social media. Haruna Idrisu and minority MPs to appear before court. Let me state emphatically that the minority leader and members of the NDC in Parliament are an integral part and members of the NDC party, the National Democratic Congress, and we are law-abiding citizens of Ghana. Regrettably, we don't respond and will not respond to social media invitations by the Ghana Police Service. I have not been personally served, as is the requirement of the law, and many of my colleagues. And therefore, I should only be walking to court if there was personal service of that writ of summons. But I should presume, without fear of contradiction, that the Ghana Police Service is allowing itself to be used as a tool of manipulation. I've repeatedly told you that I am not a coward, and I don't intend ever to be cowed by any machination by any person, including the Ghana Police Service. They have some confusion in their mind. They should seek to resolve the confusion, the Ghana Police Service. I've seen names like Dr. Rawlings Ezeneta. She didn't take part in the process. The Honorable Adongo of Bolga didn't take part in the process. So somebody somewhere rehearsed enemies that they are targeting for purpose of humiliation and to project us as if we are not law-abiding citizens. They should resolve those confusions in their minds and come back properly in accordance with law. But even what is more remarkable and significant is that the criminals who so declared resource and denied us of our mandate in Techima are walking free. What they did is in breach of law. It's in breach of process. Nobody is prosecuting them. Nobody is prosecuting those who shot and killed the 3 persons acknowledged by the EC in Techima. That is criminal killing. Yet, members of parliament presenting a harmless petition, and when I say the police is confused, you didn't understand. they should go and get some training in terms of the law. What members of parliament did was to embark on lawful procession, nothing more, not a demonstration. That's why the Constitution in Article 21 uses the words procession and demonstration. In any case, be informed that the NDC officially notified the Ghana Police Service that the party will embark on a number and series of actions. We are part of the NDC. We took part in that action, but we took part in a lawful, harmless procession. Maybe tomorrow when you are processing to church, they will stop you. God bless.
Haruna Idris is a minority leader there. Let's connect with our Parliamentary Affairs correspondent, Joseph Opoku Gakpo, who's joining me right now on phone. Hello, Joseph.
Yes, good afternoon to you.
Good afternoon, Joseph. It's good to hear from you once again. Now, they were expected in courts this morning, but that didn't happen. They have been in Parliament all day.
Precisely, and I've spotted a number of them around. In terms of the MPs who the police are seeking to get prosecuted, the minority leader himself, you heard him right there. I've also spotted a number of others, John Jinafo, Yusuf Jaja, Roxton Dafiamaso, and a number of the MPs. Muntaka Mubarak, the minority chief, have spotted him as well. In fact, there is a meeting of the minority caucus that's happening right now as we speak, right in the premises of Parliament, and a number of items on the agenda, including this court action that has been taken against some of them, as well as a number of other issues, including who would lead the other side of the House going into the next Parliament. But essentially, the defense that the MPs are mounting is that they've not officially received this summons. They claim that they've only seen it on social media. Some of them actually have admitted in backroom conversations that they've seen this in their pigeonholes or their shelves in Parliament. But essentially, the argument they make is that per the provisions in Article 117 of the Constitution, if you want to serve criminal proceedings or even civil court proceedings on an MP, you would have to do it at a time when he is not getting to or returning from Parliament. And they say they will only honor a court summons after an agreement has actually come between the police and the Speaker on the court on when they should attend to the court proceedings. That's the only basis upon which they will show up to face any said prosecutions in court.
So, Joseph, I believe you've interacted with the other members of Parliament. Do they share in the position of the minority leader, Haruna Idrisu?
Funny enough, for those on the majority side, it looks like there's a bit of a division in terms of how the approach should have been. Some of them accuse the minority MPs of acting lawlessly, while others make the point that MPs actually have some immunity to a certain extent. Not exactly immunity, but some form of protection per the requirement in the Constitution that you can't serve court processes on them or get them involved in court processes without going through a certain process. And they insist that that should be done rightly so that then no one else faces any such hounding before a court without the due processes being exhausted. So for those on the majority side, there's a bit of a division on what the approach should have been.
They insist, by the way, today in Parliament that they did not receive the court summons, correct?
Say that again for me.
They insisted today that they hadn't seen or they didn't receive the court summons.
Precisely. Now, the indication is that these summons actually came individually, all the about 20 minority MPs involved. You know, there are 20 of them, and then there is Peter Boamo Otukuno, who is the Deputy General Secretary. The indication we get is that for all the 20 of them, these summons came individually. So then it's dropped in their pigeonholes or their cells right here in Parliament, and the details spell out the statement of offense, the prospective charges, and then when you look at the list, depending on whose pigeonhole it's dropped, then that individual's name gets picked on the list. So some MPs in backroom conversations confirmed that they saw this in their pigeonhole, but still raised the point about the fact that they are supposed to be in Parliament today. No one can summon them to a court when they are attending to Parliament. But some also make the argument that they've not seen this summons at all, including the point that has been made by the minority leader, Haruna Idrisu, that he hasn't seen this at all, and he's only heard it on social media, which is forming the basis for a conversation, and they are not ready to respond to any summons which haven't come to them officially and which they've only read in the media.
Joseph, thank you very much. Interesting days ahead. Joseph Opoku Gakpo is our Parliamentary Affairs correspondent. Before we go, the Supreme Court has ruled that Justice Clemens Onyenuga can join 4 other justices to hear the Sandro Kofi Akpafo-Likpe and Lolobi case. Lawyer for the Seoul residents, led by Chachuchi Kata this morning, accused the judge of possible bias. Court correspondent Joseph Akable has more in this report.
Hearing commenced on Monday with lawyer for the Seoul resident Chachuchi Kata informing the court that he wants a member of the panel to recuse himself. This is Justice Clemens Onyenuga, who he described as having a long-standing relationship with the Hohoi MP-elect John Peter Amewu. And so the justice was asked by his colleagues on the bench as to whether there is any merit in that allegation, and he said no, he has no such friendship with the energy minister. Afterwards, Mr. Chikata then proceeded to raise the objection, saying that because the justice has failed to recuse himself, he is formally requesting of the court to decide on whether or not he recuses himself. He said he was prepared to call on witnesses that will prove that indeed there was that long-standing relationship between the energy minister and the justice of the Supreme Court. Deputy Attorney General Godfrey Adame responded in open court that there's no evidence backing the said allegation, and in fact, for such a request to even merit a trial, it ought to come with some evidence in the form of statements that points onto the nature of the relationship. But since that has not been attached, then there's no point in the court heeding to that particular request. The 5-member panel went for break for about 35 minutes and came back with the decision that Justice Onyenuga remains on the panel, indicating that in terms of the interest of Mr. Amewu in this particular case before the Supreme Court, it was too remote because, one, he was not an interested party in this particular case that has been filed, and secondly, the case relates to a jurisdiction issue, which is the question on whether or not the whole High Court has the legal mandate to hear the case that involves Mr. Amewu at that High Court. The panel then proceeded to hear the main issue that relates to the case that has been filed by the Attorney General's office. Mr. Godfrey Adame for 20 minutes urged the court to stop the whole High Court from proceeding to hear the matter, insisting that the residents of Seoul do not have voting rights in the Hohoi constituency, and that if there is any constituency where they ought to have issues, it has to do with the Buem constituency. He said as far as his office is concerned, it holds the view that the EC erred in not allowing them vote in the Buem constituency, since the court in June stated in clear terms that Seoul cannot fall within the Hohoi constituency. Mr. Chikata, who then requested to argue for an hour and a half, told the court that the AG has accepted that some rights have been breached, and so the court should allow the High Court that is properly clothed with the power to determine such matters to deal with it. The court, after hearing both sides, adjourned proceedings to January 5th to deliver its judgment. It has allowed Mr. Chikata 8:30 a.m. to file additional documents if he's minded to do so, while the court says by 12 noon it will deliver its ruling, being mindful of whatever documents that Mr. Chikata may file will be incorporated into the judgment of the court. If it requires it to take some more time, then that decision will be rendered at 2 p.m. on January 5. So this is what transpired at the Supreme Court. Reporting for JoyNews from the Supreme Court, my name is Joseph Akable.
There you have it. Let's take a break here for sport here on The Pulse.
So, Martha, how are you doing? How do you feel after graduating the State University?
I'm doing okay. Thank you for asking. Honestly, I'm so happy because it's not an easy journey. So I am very happy that I was able to get to this far.
Good stuff. Good stuff. So you said it's not been an easy journey. Tell us a bit about the journey. How's it gone?
You know, every journey always it starts with a step, one step at a time. So maybe he as a young adult trying to pursue my degree, all this and different background, different environment, you know, from Ghana to different world. It's not easy because you need to adjust to everything. Even the studying, the practice and competition, food, language barrier, everything, that is a lot. It comes with a lot. You have to go through all this process. So it's been a long journey. It is a long journey.
Yeah, wow. You just tell me how it feels, because your life changed all of a sudden after you won gold in China, and here you are in the US. I mean, when you sit down in your quiet corner, how do you see it all? How are you managing that whole?
I see like a blessing. It was a blessing because God used everything that happened to us in this life, like for a reason, and He make everything that we pass through, whether it's a challenge, everything, it tells us something. Because after the Olympic gold medal, it was a lot that went on, but I thought about it like as a preparation. God was preparing me for something great. So that's what I thought about. And I see like a challenge. And that challenge has really helped me to work so hard. Trust me, it has really helped me work so hard. I may not understand it after first, but now I do understand it. Like all those things, it has really helped me become who I am right now. So when I say it's been a long journey, I know everybody that watching me or listening to me will understand how it feels like to go all the way like 5,000 miles away from your country to get something done or to pursue education or just even a work, just to go to work. It's not an easy journey because you have to go by everything that is around you. You have to put some negative aside, and you have to focus on the positive side. So it's all about challenge, and you have to balance both because some positive side may help you, and most of the time people think only the negative thoughts can help you. It can, but sometimes the negative things about you have to encourage you to work harder. That's what happened to me. So all those bad things, all those challenges, all those negative thoughts, everything that I went through right now has really encouraged me to be the person I am today. Without that, I don't think I will get to this far.
Well, that's brilliant, and it's good to know that you're doing so well. So now let's talk about your athlete life in the US. I know you won a couple of awards. We have been following that very closely. How would you rate yourself?
I will never rate myself as an average. I think even God will not be happy for that. I would say excellent because it is not easy for you to come here to adjust to everything. It might not seem good to how it is to get to everything to get. It wasn't an easy achievement. My coach always tell me that you always have to take an action to actualize your vision, because a vision without an action becomes a nightmare. So I always make sure I go with that word. It's a big word that he said, and he said that to the sense that I never give up. I'm always somebody who keep working towards something that I want to achieve. Whether it is hard, I see it like even if it is hard, you have to keep pushing. So I keep pushing myself. I keep encouraging myself. I keep thinking I keep putting negative things aside of me and then focus on the negative part. And everything I need to improve, I have to improve everything that I'm doing and keep moving. Sometimes it seems to be far, but when you keep working towards it, get closer. So I'm blessed with my athletics career right now. I'm blessed with people around me, blessed with everything I've gone through and everything that has happened and what is about to happen. So I will never grade myself like an average athlete. I'm good, and I can't even say excellent. Let me say excellent because it has not been easy to be 3 times All-American. And I think like 8 times All-MEAC champions and 4 times outstanding performer, both indoor and outdoor, and then cross country. So it's a great achievement.
Martha Bisa there. Certainly, that's a story that a conversation we had earlier. There is more news at myjoyonline.com. I'll urge you to log on and share the links with your friends as well. My name is Gifty Ando Apia.